everyone.
You hear us, Rob?
Mr. Beauregard's logging on.
Are we all able to communicate? Rob's on mute.
I'm able to communicate.
Okay, that being the case, call the meeting to order. The last meeting's minutes.
Motion to approve minutes.
Second.
All in favor?
Aye.
Aye.
Okay, Laura, we're going to have a general department update, in which we're going to introduce you. Everybody, Laura.
So I'm Laura. We've all met at the interviews. I've been settling in quite nicely. The department is awesome. Everybody's great to work with. It's actually a perfect fit. I'm very happy.
That's good to hear. Welcome to your first meeting.
And hopefully it goes smoothly. Now the
Michael.
first, oh, go ahead.
I'm sorry, did you see Mr. Beauregard?
Yep.
Okay.
So the first,
Sorry, are we supposed to see him on video?
I was just waiting until we got to that section, but now we're there, so I'll promote him.
Okay.
Looks like we have him, but we don't have anyone from the gas station here.
well, being as forgiving as this board is, we can move on to the next item and then come back to the gas station's appeal. Does that sound reasonable? Okay, so the next item is body art regulation. So at the last meeting, let me see if I can remember, we had a request for on the lips, correct?
Body art on the lips from
Okay.
particular one or two salons. I can't remember if it was somewheres. And then we just required information to be sent so that we could check.
So there's two things, if I understand correctly. One of them is we sent over section 14 body art and piercing body tattoos, the paperwork. We updated page 39. Has anyone had a chance to look at that?
That was
The
an
application
update.
for practitioner.
I skimmed through it. What update have we instituted?
Okay, so basically throughout the entire document, we updated, just cleaned up a few grammatical errors and updated the gender. So that was just a cleaning thing. You know, we went from the from the gender to the gender neutral, from the she, he to the they, them. That's
Okay.
throughout the document. And then in 314.010, that's where we put the section for the apprenticeship. So it just says, you know, the highlights, that they have to be licensed, the license is $200. They need a license, they need to be overseen, they needed a grade, grade of C or better. Does everybody see that section?
Sorry, hold on. Sorry, I'm trying to find it. So I thought they were gonna send documentation on what they were doing, and we were gonna review it to make sure that it was safe to do on lips, that it was different from microblading, and there was a different procedure set.
So we did not get this information? Obviously not. Now, we can do one of two things. We can just put it on the back burner and not take any action. Or we can contact the two individuals and say, if you want us to proceed on this, we need requested information.
So I think that there were two pieces. One was the lip pigmentation, and we have both Leah and Lauren here who both work in microblading. Leah has her hand raised, and Lauren said that we can add her to chat with your permission. And then there was also a question about apprenticeship for people that don't have the 2 years experience or are unable. So I don't know which one you want to.
Yeah,
Go
which one would
first.
you like to tackle first?
Why don't you tackle the lips? Now, do either of two women want to present the argument for it? Leah?
Yes, I could certainly speak. Can you hear me?
Yes.
Yes.
Yeah, we can hear you.
So I think what had happened before is there might have been a little bit of confusion. It seems as though in the past it was discussed whether or not micropigmentation could be done, and micropigmentation is done with a machine. We also do a technique called microblade, which is something totally different. So we are doing micropigmentation, which is something that has already been reviewed and approved by the board. So I think that there was just some confusion as to whether or not we were using the microblade in order to administer that treatment that is done on the lips. And it is not done with a microblade. It's done with the same machine that's used for micropigmentation that's already been approved through the board.
What
Can I-
year are you referring to for the approval? Do you remember the year?
Can I piggyback on what Leah just said? This is Lauren.
So my question is just, when we were presented with the micropigmentation, it was only microblade procedure that was reviewed.
I'm not actually aware of when that changed. I just know that Lauren, maybe she might be able to speak to that, because I think that she was the one who talked to Frank about the use of the machine originally.
Yeah, so technically our license covers microblading and micropigmentation. So if we take the courses and we get the certifications, we're allowed to do each of the services that are covered under the blanket of our license. We just have to have that certification underneath the license. So I have my microblading and eyebrow certification. So that's currently the only service that I provide. And if I go take the course, it's technically under the blanket of my license, I should be able to just jump right into it. So for me, it was more of like a formality just to let you guys know I was doing the lip pigmentation, and I was under the impression that it was already covered under the license, which I agree with Leah that Frank had mentioned that we were allowed to do as long as we had taken the course.
Yeah, it's the exact same technique that we're using for the brow. It's just moving, the same equipment, the same pigmentation, the same technique a few inches farther down the face. So it's not opening any risk for anything different than what has already been approved by the board.
So I have no problem with that under your license. It was that, so the lip is mucosa, technically not derm, and we have not reviewed anything other than dermal pigmentation. It was only procedures presented for microblading from as long as I've been on the board. And then we had one presentation of, I think, nipple tattooing. And that was a completely different presentation that was done in conjunction for or with a plastic surgeon on the board of wherever that person was doing it. Both times it was presented as sort of like ancillary treatment for cancer patients. But I haven't seen any documentation. So I haven't actually seen the procedure or what we asked for. And I remember it was agreed to that there would be a presentation for us to review what exactly is going on with the lip, so we can review that is safe.
I sent over a chapter in the book that I received from school of the lip pigmentation procedure. Michael, did you get that?
I did not get that.
I had also dropped off to Michael the entire textbook with like all of the information necessary to be able to understand. And I can certainly put together a presentation if that's necessary. It's coming to my surprise at this point because, people under the licenses of Newburyport have been offering these services for years. So I don't really understand how we're at this point where there's so much gray area as to the understanding of the technique and what it is that we're talking about at this point. But
right, there's always regulation, there's OSHA, there's always going to be a lot of gray area, and it's unfortunate there's always regulation, and it sucks in a business to have to deal with it. But I mean, that's why we're here. We have nothing, there's nowhere to go but through it. So as it's being presented, we actually should get a presentation on what the procedure is. It doesn't have to be extensive. It just has to be, thorough enough that we know what we're looking at and talking about.
I had spoken to the owner of the school I went to at Prettyology, and she did mention that if the director wanted to reach out to the Board of Health in Boston and review and chat with them about their regulations and what they allow and what our license technically covers and why we're allowed to do what we're allowed to do. I haven't taken the course for lip pigmentation. I'm kind of just waiting on signing up for the class because it is, a few $1,000s. And I didn't want to jump into the class if I wasn't allowed to perform the service.
So if we could just get sent, not exact, but if just the procedure itself, how far it's going in the lip, what's being used, just the basics is presented.
I can tell you that. It's just a needle that's micro.
Right, but so if it was sent to us and then we could just evaluate it and just make sure there isn't any.
Yeah, no, I totally get it. Like it's a different part. I get it. It's mucous membrane, different from just the epidermis and dermis, but.
Right, just to make sure there isn't anything we're missing.
Okay, Michael, can you look through your emails and see if the pictures sent to you? Because if not, I can like photocopy them at Staples and then drop them on by. I just want to make sure you have that information.
I do not. The last email I have is from March 14th before the previous meeting.
Okay, you guys are open till 12 tomorrow, yeah?
Yes.
Okay, cool. I'm gonna go to Staples in the morning. I'll Xerox that entire chapter off for you and then drop it off. I'll try to contact the Board of Health of Boston and see if they can kind of forward any information as well.
That'd be great.
Okay.
It doesn't have to be a lot, just
Sam,
that.
can I ask a question about this?
Who,
Ask you
did
a
you ask
question?
me?
You want your lips done?
No, I don't want my lid down. I want to ask, I just want to understand what's our concern, Sam, with this.
So we approved everything that was derm so far. This is a different part of the body. We haven't had that presentation at all. I don't know if you're familiar enough with it to be able to
No,
say.
I'm not at all. I'm not saying we shouldn't be concerned. I want to just understand why.
So
we're concerned.
Right, so, I mean,
Why are we
off the
concerned about
cuff,
this? And I guess is my,
off the cuff, if there's certain regulations for a Vermilion border or just the lip itself, prophylactic, Valtrex, things like that that are often used.
Yes.
It's in the literature, so I just
Yeah.
want to know what, I'm just dotting my i's. I just thought we would get a little thing
oh,
by
no, I
now,
agree.
and
I
then we
agree.
would
I
look
want to
it up, and
understand,
then
like,
it'd be fine.
yeah, no, I agree totally. I just want to understand, like, so if we approve something, say the skin procedure, right? Are we like, what's the concern of what should be the concern of the Board of Health? Like, are we worried about like disease
Infection.
transmission?
Like what other, if you're
But
comfortable with,
we're not going to say that this is like a safe, effective procedure, and we're saying that this is not a public health risk for disease transmission, I guess, or something like that, right? Or what?
that's a huge open-ended
Do you
question, but
understand my question?
if we're looking at anything we're looking at, I'm assuming we're looking for any pitfalls or any other issues that may be coming down, anything that's going to come back to, like, well, you approve this, were you aware of this? In this literature, this is required or suggested. I'm not the type, as the Board of Health members know, like, I don't go with, well, this town approved this and this town, like, a lot of towns are doing a lot of stupid things. So I need to make sure that it makes sense in its own merit. It's not, I mean, it shouldn't be that big of a deal, but the minimum is to just have the information on exactly what we're talking about, and then to look that up and then present it. But
Yeah,
unless
no,
there's someone on the board that already knows a
I'm just
lot about
asking. I'm just asking clarifying questions. I just want to understand where our responsibility is here. I think, the responsibility in my mind would be to say that this equipment is kept in a sanitary way. It's not a risk there's no risk for disease transmission.
right, but you don't know what equipment.
I don't know that I'm going to say that someone is necessarily going to have a positive outcome with this procedure, right? I mean, that's
No,
not what
yeah.
we're doing, right?
No, we're not saying that at all, or we're not recommending it or giving our, we're not promoting it. It's just, you can't, so if you don't know all the equipment, you can't worry about what equipment is kept in a
Okay.
sanitary way, right?
Okay. Yeah, I'm just wanting to understand, that's all.
Dr. Sam, I have another question. Sorry, this is Lauren again.
Oh.
You brought up the areola tattooing. So technically that would be dermis tattooing, just like the eyebrows. Am I covered under that if I were to take the areola class?
I think so, based on, I don't have the best memory of what our outcome was. I know for sure that we had that presentation. I'm not going to forget that presentation. And I think that was approved, but Laura can look that up, or if Rob or Robin remember. Don't
I think
quote me
I,
if-
I think I was confused about that issue too. I wasn't sure why. I don't know that I understood why the nipple concept seemed different than another part of the body.
I think it was just the where it was being done. But I mean, we can go back and look that up. Like not where on the body, but what facility was doing it and under what supervision.
I was doing some research into that a couple months ago, and I think I can look back. It's definitely in the minutes because I definitely remember reading it. But I believe it was in order to do the pigmentation around the nipple, it had to be, I think, signed off by the surgeon that they were. There's some form that the surgeon needed to sign saying they were okay to have it done post surgery.
Right, because it was post-surgery and they had to be clear of infection or.
Okay.
Okay, so that's just an added on paperwork for us for that service, but it's technically allowed. Sorry,
As
you're
far-
muted.
Yes, I think so.
Okay,
I
cool.
think that's right. That sounds familiar.
Okay,
So
awesome.
we should double check, but I think so.
Okay, so I plan on in the future when I get the okay for the lip pigmentation, I just want you guys to know what my plan is to take that areola class as well as the lip pigmentation class so I can add them on to my services.
Does anyone have any other comment on that?
Does anyone need their
I think-
eyebrows?
I think we're good. I'm good with eyebrows, as you can see.
Anyone's?
Almost, not yet.
All right.
Could I just ask a question as well? Because it sounds like what we're looking for is just some general clarification that what the specifics are for this area of the body. So I heard you say something about vowel tracts, and so you probably want to see the consent forms that we're filling out to make sure that we are asking those appropriate questions prior to providing the service, and that that people have been trained specifically to be working on this area. Cosmetic tattooing, what we are talking about here, micropigmentation, is the entire procedure has been designed around being able to provide this procedure on this part of the body. The brows, the eyes, and the lips, and the areola, that's what this service was designed for. I don't feel like it will be challenging for us to show you that the service has merit and that it is a safe service that can be responsibly provided by those who are properly trained.
Well said.
I would just bullet point, like, so basically you just want to have equipment, how far into the lip you're going, layer, what's single use, what's not single use, and how you autoclave. I mean, most of it's going to be similar, but in case there's like a different tool you use that's only for the lip, that's single use, or
We
Other
use
place-
all single use and we sanitize everything in between. Everything's wrapped in like tattoo equipment, basically.
Yeah, and the entire front part of the machine gets removed and thrown away. So it's really just
You
the
don't-
battery pack that's then covered in plastic.
I'm not too concerned with it. I'm just mentioning what to present, and then, you know, there's going to be OSHA regulations on all of those things that are not us, but, you know, obviously.
I have a question on presenting and what that entails. Should I bring in like all my single use stuff and my machine to like show you? Or did you want me to make
Photograph is enough.
a photograph?
Yeah, just
All
like a itemization, then like maybe brief description of the procedure, how it differs from what we already approved. And then within enough time that we can, you know, review it.
Okay. All right. Thank you.
So this is going to be continued until the next meeting. And at that time, we should be able to put this whole issue to bed. Any other comments on this?
Nope.
Okay, then moving back, is there anybody here from Newburyport One Stop?
Not yet. I'm emailing that. I had sent them an email earlier in the week, but emailing them the link again right now. Maybe they'll hop on.
Okay, so we'll move on to the next item and see if they show up. Okay, so we're gonna have an update on the fee schedule.
Before we do the fee schedule, do we want to do the practitioner part, or do we want to put that on the list next month? So the practitioner section is page 39, and that's just what they need to be a practitioner in the town. That's separate from the lip pigmentation. That's just the regulation.
I think they had questions on the apprenticeship and things like that.
That as
That I think
well?
you sorted out. Yeah, that was a completely separate question, I think.
So anything else on that issue?
Am I still in? Can you
We're
still
here
hear
if
me?
that's what we want to know.
So there was some updates that you have made somewhat recently, or are not even concretely in place or have changed quite yet, that are going to be coming into effect with this new round of laws that you have made. And just, I suppose, out of curiosity, this hasn't been an issue up until now. There have been many people who have received their license in Newburyport. In fact, I would say most of them have been underneath the Boutique LLC, master license for cosmetic tattooing. And I'm just curious as to whether or not we can be in agreement that the people who have made the efforts and, gone through what they've gone through to be able to have their applications in there and be considered for licenses, be able to be grandfathered in before all of these changes are made.
Well, just my personal opinion, if these individuals have been approved for their licensure, then any new regs, I think that these individuals should be grandfathered in.
Yeah, I appreciate that. It's, we have a girl who is, you guys have been gracious enough to give really beautiful, meaningful opportunities to 5 young women who have been able to make lucrative careers with this service, and one of which who's been able to go out on her own and in another city and be very successful as a business owner as well. And I mean, these are tremendous opportunities. And to have one of my girls who is in limbo right now with new regulations all of a sudden slamming a door in her face, it just seems, I'm just hoping that we can be understanding that she should have a grandfather.
Do you have anything, Laura, on I'm not as versed in these rules that you just mentioned, but any updates that you think conflict with that?
I think it's great for me to be able to be here and be involved in helping move forward with some of these different regulations, because I think Laura and I had spoke on the phone, and it's good to have an ally and somebody who understands what's going on. And I think Lauren also is really well versed, and the two of us are the 2 license holders that are in Newburyport. There isn't a lot of interest in this license, unfortunately, it doesn't seem, but it seems like the 2 of us are really making it work, and it's important to us. So we're definitely here for feedback and to be able to help in clarity and understanding, so that you guys are feeling comfortable with what we're doing.
Laura, did you want to add anything?
No, I would just say that I agree, grandfathering the 5 people that are already doing it, but if you decide to pass the practitioner application, it would start today if you voted in. So it's just, there wasn't anything before at all. We just added that entire section.
We have to vote in the new regulations today.
Yeah, you'd have, well, if you choose to do it today, yes, you'd have to vote in to update them.
So they're not even in effect yet.
Right.
Okay.
A lot of these changes are basically housekeeping changes.
The majority of the changes throughout the document were just a few grammatical things and just updating punctuation, except for page 39, section 3.14010. That's all about the apprenticeship permit. That's the only thing that's really changed in the document.
And how is that different from what we have?
You didn't have one before.
Oh,
It was mentioned, but it wasn't formalized, I think. So they had read it and were confused by it, and I also didn't remember it in any of our previous discussions. But do we want to table that and vote on that next time too? If we're not really enforcing it on anyone that's practicing right now. Do you want to vote on it?
do you feel comfortable voting it on it now, or would you prefer to wait?
I mean, I haven't reread it, just based on what Laura said, but I don't know. Rob, what do you think?
Why don't we table it and we'll vote it on both together?
Okay.
Okay,
So the next thing is our fee schedule. So again, some things on this are just housekeeping. I can walk you through it if you'd like. Is that okay?
sure.
Okay. Though it is in the regulations that individuals do sign when they get their tobacco permit, it was never listed on our fee list on our schedule. So we did add in section 2, the tobacco regulations, we added sale to a person under the age of 21. So again, that's in reference to the regulations that they do sign when they get their application. So it's just a matter of housekeeping to put it on here. Under temporary food events, a little bit further down, we had it listed that 1 or 2 day events were $100, and then every event day after that would be $50. And we just changed it to $50 across the board. So every day is $50 instead of first 2 days is 100, then third day is 50. It's the same thing, just a little cleaner. Event organizer is $100. It was already voted on in the past, but it just was not on this list. The disposal for the installer exam, I've increased that from $10 to $50 because we're going to have to do an exam and start implementing that, and $10 is a little thin on that one. Choke server, you did already vote on all 4 of those, but they were not on the list, so they've been updated. And the burial permit was stated at, 1 second. Burial permit was $10. And in February of 2016, you voted to increase that to $15, but it was not updated on the fee schedule. And the last thing was the well plan review permit. It was $25, and I was hoping we could increase that to $50. And that, just so you know, is our first online permit. So we're starting to roll out the online permit. And that one was the first one, and it's already been filled in. Like, we've already had our first online application this month. So 2 changes, really.
Does anybody have any questions regarding these changes?
No questions.
No,
Do we want to just move forward and approve the changes?
motion to approve updated fee schedule.
Second,
All in
All-
favor?
Aye.
Okay. Okay, the COVID-19 update.
So we did send you the information, the chart. You will see that in January, we did have 608 cases. And that was our all-time high after Christmas. Right now in April, we're at 62 cases, a small uptick, but it's 3.91%. And then you'll see on the last chart that we provided that the highest it's been is 9 cases in one day, and that was only one time this month. But we're looking at a 3.91% positivity rate right now. That's based on 2 weeks, and the 2 weeks prior were at 3.64.
So it's went from 3.64 to 3.91.
Yes.
I don't know
So
if
we
anyone's
might
really
feel a
getting
little
tested anymore.
Right, we might see a little uptick now after Easter too.
Does everyone just feel confident in who's testing and who's not testing? And then, do we have any information on the hospitalization or admissions? No.
Well, I was at the hospital today during my Thursday volunteerism, and it's my understanding that there are 7 cases in the hospital. And I don't know where that is compared to any other time.
Well, as we stand right now, there's 62 cases in town. I mean, city.
So I just figure we just keep monitoring this. That being said, is there anything else regarding COVID-19? Okay, then we'll move on to the beach.
Has one stop coming yet, Michael?
No, and I've emailed them, and then I tried calling the cell phone number of the general manager that's on his letter, but it says Verizon not in service. So Ron, I don't know if you have another number for him or if he's just not going to show up today.
I don't have another contact number, unfortunately.
I'll keep digging and see if we have anything else and try calling again.
I'll check my inspection notes to see if I have something. I may. I know I've contacted them during my inspections recently, so I'll check that.
In the meantime, I will move on to beaches, if that's okay.
Sure.
So at this time, we're testing the water at 4 locations: the Point, End of Island 2, End of Island 1, and 55th Street. End of Island 2 and End of Island 1 are approximately 50 feet apart. So I'm suggesting that we vote on eliminating End of Island 1 because it's so close to the other one. So the state picks up the 12 tests that start on June 12th. and we pick up the test prior to that. So they're $31. We save about $100 if there's any retesting that could double to $200. And I'm not so much worried about the $31, just because they're only 50 feet apart though. It seems like a lot to test all four.
And
So I was
by
proposing dropping that.
by going to 3 instead of 4, we're not compromising anything?
No, because they're only 50 feet apart.
Okay.
Is there another location that'd be better to test or covered with the 3?
I didn't ask the harbor master and the state that. I can ask them that question if you want to table that and come back to it next month. But I asked about what the thoughts were on that because they were so close, and they were like, yeah.
Okay. Well, I think we can move on, but you can touch base with the harbor master to see whether or not there is another area that should be looked at.
Okay. In the meantime, would you like to remove number 1 or leave it?
I would say to remove it because it makes no sense to have 2 sites 50 feet apart.
Motion to remove point, what is it?
Site 1? Is that site
Island
number 1?
Site number 1.
Second.
Remove Site 1. Second.
All in favor?
Aye.
And I will
Oh,
check with the harbor master, and if he suggests another location, I will let you all know.
okay. Sounds reasonable. Okay. We have 2 upcoming events, the blood drive and the choke saver courses.
The blood drive is Tuesday, May 3rd. At this point, we have 1 open spot. That open spot is at 3 p.m. and that is for a power red. And a power red is you need to be O positive, O negative, A negative, or B negative. If you're a male, you must be 17 years or older, a minimum of 5 feet 1 inches, and a minimum of at least 130 pounds. If you're a female, you must be the same 4 categories of blood type, and you must be at least 19 years old, minimum of 5 feet 5 inches, and weigh a minimum of 150 pounds. If you fall into those areas, there is 1 spot left on May 3rd at 3 p.m. to donate blood. The next thing is the choke saver class. Right now on April 25th, we have 7 people that have signed up that are pre-registered. And I just sent you a copy of the flyer and the application just so you can see it. I know you voted on it last month, but just so you knew what it looked like.
Okay, now on to the future meetings. I have a question on the May 26th meeting. Is that the meeting that the people from mosquito control are going to be at the meeting?
Michael, they said they're doing the presentation, right, instead? Are they coming?
Well, so this came up and this was going to be a question for the board is they got a really big inquiry from boards of health to have a presentation done. So they did one and recorded it. So she reached out and she said they're still willing to come do a presentation or come answer questions. Or if you want, we can just send you the recording of their presentation that they made. If you have any questions, we can facilitate it that way with them. It's up to you, really, of how you want to do it.
I say recording. That's just my personal opinion, though. Anybody else?
So if we took the video presentation, would we have a Zoom meeting and present this?
Well,
To
we
watch the
could
video?
do-
Yeah,
Wouldn't it be sent before and we
was-
just watch it?
I was sort of thinking we watch it on our own time. Is that what you were thinking, Michael?
Yeah, I can get the link from her at any time and send it out to you guys.
okay. That makes more sense.
Is the date of the 26th okay for a meeting though?
The 26th.
It's okay with me.
Just a minute.
Me too.
Works for me.
And how about June 23rd at 7 PM?
Okay.
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 What'd you say, 7:30?
7.
7, okay, that's right.
So the last thing is one stop.
And they're still not on.
Well,
We can-
what
Go
was the
ahead.
plan? They were gonna, why were they gonna log on to?
They were going to appeal the $1,000 fine, correct?
Yes.
So, is that a forfeit or?
Well, we could do one of two things. We can have a heart of gold and tell them they have to be here next meeting or that's it. Or we can take the line, they didn't show, so they owed $1,000. Ron, you have any input on this?
I always feel, and I know the board does too, that, the only process should be due process and have it, it's a hefty fine. The state has set this new fine level, so it goes beyond any locality's level of fines. I wouldn't have an objection to postponing it so they can be heard.
Okay, then if we postpone it, then we make it totally clear that if they don't respond at the next meeting, the $1,000 fine will be levied.
And we can send it via certified letter so that we get signature receipt.
That sounds good.
Michael's always thinking. I like it.
That's why he makes the big bucks. Okay, if there's nothing else to discuss, I would entertain a motion to adjourn.
Motion to adjourn.
Second,
All in favor? Well, see you guys next month.
nice job, Laura.
Thank you.
Welcome.
Thank you, Ron. Sorry.